Welcome to this month's team brief. I want to tell you a little bit about what's been going on in the NHS and in LPT particularly, some of the things that have happened, some of the things that we've got coming forward as well. Firstly, I just wanted to celebrate with you the news that the NHS had been awarded the #1 health system in the world by the Commonwealth Fund. It's a real accolade for the NHS to get that. And it says to me that we should be really proud of what we do here in the UK with the resources that we have to provide great and compassionate care. So thank you to all of you that have contributed to this. We've got to do our own thing as well in Leicestershire and Rutland, and I've attended meetings recently with my executive colleagues from different organisations, and we've underlined our commitment that we've really got to work together as one team, how we reduce the challenges that we all face on a day-to-day basis between those organisations, to reduce the barriers to working across the health and social care boundary or the acute and community boundary. We've really got to try and challenge those, and as I say, make sure that we feel that we're working together in the best interests of patients. Not always easy to do, but we've got to provide our care around families, around people, around places, around neighbourhoods, building the resilience of those neighbourhoods and those communities going forward so that we can really achieve what we want to do, which is, in reality, less people in hospital, more people cared for in their own homes, in their own communities, staying healthier for longer. And that's what we've got to really achieve together. And we can only do it if we work effectively with our partners. In the Trust, I think it's really important that we can support each other to work in our most effective way. Many of you will have filled in a pulse survey recently. It's something we do every 3 months to support the progress we're making around the staff survey. It's brief, and about 1,300 of you completed it last time, and it told us we're making progress in areas. And we've got some really good results, but there are still areas that I think that we need to focus and work harder on. And one of those is the support that we give to each other, and especially the support managers give to their staff. And I just wanted to encourage all those people with management responsibilities that we're really encouraging everybody at the moment to undertake additional training and support. As many of you will be aware, there are 4 modules based around supportive management behaviour, some essential HR skills, managing sickness absence, and those modules are really important that we get right to support people in the work that they do. As we know, having a supportive manager is one of the most important things for us at work, as well as being part of supportive and highly effective teams. Over the last month, we've also had some great news. We received some investment from the national government in terms of helping and supporting us to build a new adolescent unit. As many of you will be aware, our Adolescent Unit, our inpatient unit for children and young people with mental health problems, has been temporarily located in Colville Hospital. We're going to move that back to the city. We've got an £8 million investment which will help us build a state-of-the-art unit for 15 young people, 10 with general psychiatric and mental health problems, 5 for young people with eating disorders, something we've never had before. It's going to be a great facility which we hope to open in 2019. That goes to complement the other investment we've had in our CAM service. As many of you will be aware, our children's mental health service has been under enormous pressure with 20% increases in referrals year on year. So it's really good that we've had additional investment in our access team to help reduce the amount of waits, in our crisis team to help respond to young people in mental health crises, and more resources in our children's eating disorders team. Again, something that we've seen increasingly growing in numbers over the last few years. Really pleased with those investments. Now we need to get them working, and get them working for the people of Leicester, Leicestershire and Rutland. And finally, every year we hold an annual general meeting which gives us both an opportunity to celebrate what we're doing. I know many of you will come, and we have stalls, advertising and celebrating the work that individual services do, and I hope as many of you will be able to get there as possible. Just to let you know that it's on the 12th of September. It's where we publicly celebrate and the services, and also look at areas that we need to improve. It's going to be held on 12th of September at the People's Centre, and I hope as many of you can attend as possible. possible. Thanks for listening.